If you feel like everyone around you is sick, you may have good reason. Flu season seems to be peaking early in Illinois, with more than 100 more influenza outbreaks across the state this season compared with last season at this time. And the most common strain of flu this year is one associated with more severe symptoms, according to the Illinois Department of Public Health. Last year we saw the peak in February, said Melaney Arnold, spokeswoman for the health department. It might just be starting earlier. The current levels also are higher than most flu seasons since 2009-10, state records show. From the start of 2017 through December 31st, there were 344 total flu-related intensive care unit admissions across the state, and 135 outbreaks defined as 2 or more cases of the flu in a group setting reporting to the state, and at least 1 confirmed through testing. Those numbers are much higher than the same intensive care unit admissions and outbreak statistics from the last 2 seasons, 40 and 11 in 2016, 56 and 2 in 2015. In 2014, there was a similar spike with 497 intensive care unit admissions across the state and 123 outbreaks. According to health department statistics, the high number of cases prompted state health officials on deck 27 to recommend that hospitals limit visitors and put precautions into place aimed at preventing and controlling further spread of the flu. Several hospital systems, including Northwestern Medicine hospitals and the 12 Advocate Healthcare hospitals across Chicagoland and central Illinois, have done so. The precautions include restricting hospital visits for anyone younger than 18, limiting the number of visitors to 2 per patient, promoting hand washing and assessing visitors for symptoms of acute respiratory illness, and asking them to leave or at the very least, wear a mask. Cook County public health officials Friday also instituted a screening policy at its hospitals to cut the risk of transmission to already ill people. Effective immediately, visitors will be screened for flu-like symptoms before being allowed to see patients. Children under 12 won't be allowed to visit patients at Stroger or Provident hospitals at all. The most common strain of influenza this year is H3N2, which was covered by this year's flu vaccine. While strains can still mutate in individual cases and render the vaccine ineffective for some people, the flu vaccine can also help lessen the severity of illness in some of these cases, said Dr. Robert Citrenberg, infectious disease physician with Advocate Healthcare. Health officials do caution that the flu vaccine can take up to 10 days to be effective after it is administered at Lutheran General Hospital in Park Ridge. Citrenberg has seen a steady influx of patients with the flu, which presents itself with symptoms including high fever, chills, muscle aches, and fatigue. He said, "People who have genuinely true influenza say that they feel like they got run over by a truck," Citrenberg said. An antiviral prescription medication known as Tamiflu is available to both children and adults suffering from the flu. Doctors recommend plenty of rest, drinking fluids, and staying away from other people, since people with the flu are typically contagious for about 7 days, Citrenberg said. Health officials also recommend that people who have not yet received a flu vaccine do so. It would be effective for the rest of the season, which typically lasts through April. The vaccine is especially important for people with chronic disease, or those who are very old or young, whose risk of getting much sicker is higher. Officials said the vaccine that Cook County health officials have on hand has an effective rate of 32%, which physicians say would prevent complications in chronically ill patients, even with that effective rate. "You're still saving lives," said Cook County Department of Public Health Senior Medical Officer Dr. Kiran Joshi in Chicago. Emergency rooms busy dealing with the flu have led to a backup in the admission of ambulance patients. This forces ambulances to hold patients longer and, in turn, a slowed response from Chicago Fire Department responders to new emergencies, said Larry Langford, spokesman for the fire department. "We're seeing a high level of stress right now, where at any given time hospitals are on complete bypass saying don't bring anybody here," Langford said. But the year before that, in 2013, there were far fewer, with 216 intensive care unit admissions and 5 outbreaks. Cook County public health officials began seeing an increase in cases in the county's suburbs and at Stroger and Provident hospitals in Chicago in December, with the number of emergency room visits above the average in the last 2 weeks, though there has only been 1 death for a person with flu-like symptoms. Doctors believe they may see more flu cases this year than last year, which they called average.